Hello, and welcome to the next section in our training, an overview of planetary health concepts. First of all, I'd like to take a moment to introduce myself since this is the first but not the last time you'll be listening to me throughout this series. I'm Haley Blackburn. I'm an assistant professor of pharmacy practice at the University of Montana Skaggs School of Pharmacy within the College of Health. I have a background as a clinical pharmacist and pharmacy educator with a personal interest in the issues of climate change and its intersections with human health that has evolved over time to overlap with my professional interests, and I've been fortunate to work on these issues in a professional capacity in recent years. I'm a co-founder of RX for Climate, an international web-based community of pharmacists that promote climate-smart pharmacy practice, and I'm a board member of Montana Health Professionals for a Healthy Climate. I also serve in a leadership role in interprofessional experiential education at the University of Montana College of Health, and I've helped to develop interprofessional learning experiences in global health and planetary health, as well as a didactic course covering the fundamentals of human health and climate change for students at and MSU. The work on this course and the training that you're currently viewing were funded through grant support from the Montana Healthcare Foundation, and so I'd like to take a moment to acknowledge and thank them for the opportunity to do this work. So we're just going to try to, in this brief presentation, explain the foundational concepts of the emerging field of planetary health and give you that framework as a way to think as we go forward in this training and as you think in the future about health issues in Montana related to climate change and the environment using this planetary health framework. So what is planetary health? How do we define this? Planetary health is an interdisciplinary approach to explore and address the effects of global environmental change on human health, while simultaneously promoting the health of natural systems. So what does this mean? Global environmental change encompasses not just climate change, but also thinking about our general impact as humans on the environment as a result of our activity on this planet. And so we're thinking about not just human health, but how do we also promote the health of these natural systems, and how do we design interventions at the kind of intersection between these two aspects to kind of promote optimal outcomes. So what is it that makes planetary health unique or differentiates it from other potential fields that you have heard of, like One Health or Eco Health or Geo Health? And certainly there's a lot of overlap or similarities. It does build on those foundations, but it's somewhat differentiated by greater attention to the political, economic, and social aspects at play in these complex systems, looking at the health of both humans and the health of the planet. And it really highlights the interconnection between these systems. I think it's also important to note that this isn't necessarily all new concepts. A lot of this really reflects indigenous knowledge, indigenous systems and thinking that's been around forever. And so we also, want to give a nod there that these ideas of interconnection with nature are not necessarily new, just kind of a return to the important knowledge that indigenous people have had for a long time. It's really also focused on building a global movement, so not just studying and kind of understanding, but also then moving toward change. So trying to quantify the increasingly apparent negative human health impacts of global environmental change, and then developing these solutions that are not only going to minimize harms to humans and to the planet, but are also going to promote the thriving of both humans and nature. And so it accounts for the future. It's really heavily rooted in the ideas of intergenerational ethics, or our moral obligations we have to future generations to leave them with a livable future. This diagram here shows just a general outline or framework of the connection of the various components of planetary health. And when we think about planetary health education, we're building in these different components, talking about our impacts on the environment and how that in turn impacts our health, how we're going to look at this through systems thinking and complexity lens, how we're looking at social justice and equity, and how we're moving all of this towards solutions and systems change, while kind of centering the overall interconnection within nature and humans and human flourishing, just at the kind of the centerpiece of these concepts. So the Anthropocene and health, basically the human era and our human-generated changes on this planet. As I mentioned before, planetary health encompasses not just climate change, but other human-driven damages or impacts on our environment and on the planet. So this also includes biodiversity loss or biodiversity shifts, our changes in land use and land cover, pollution, resource depletion, changes in our oceans, shifts in nutrient density, urbanization, all of these different things. So it kind of takes a broad view of what our global environmental change looks like, and then looks at those health impacts that are kind of a downstream shift or a result or consequence of these changes. And it's looking at these not only in just kind of a direct connection between these two, but how is this all happening or occurring within the context of these social, economic, cultural, political forces and impacts, and the complexity that's involved in all of those systems? And this brings us to the next component or kind of key tenet of planetary health, and that's the idea of systems thinking and complexity. So understanding the underlying drivers, the proximate causes, mediating factors, and health effects. So not only what are those drivers, but how are things like governance, wealth, philanthropy, technology, our cultures and behaviors ultimately mediating the outcomes and the health effects in a system. So I like this as a way to kind of think about this not only from a problem standpoint, but also from a solution standpoint. So what sort of mediating factors can we modify as we're thinking about decreasing risk, improving environmental health, and kind of moving forward in finding good solutions. The next important component in the planetary health framework is incorporation of equity and social justice. So starting off acknowledging that there are structural inequities and disproportionate impacts of global environmental change. This diagram here on the right-hand side, I think, does a really good job of illustrating this and one of the biggest ethical problems associated with climate change. So on the top there is a map showing the relative contribution to carbon emissions from each country. So the larger the country, the greater their contribution to carbon emissions. Whereas the bottom there shows the projected mortality rates relative to climate change and the downstream impacts of climate change. And so you can see that it's really, really disproportionate. Those that have emitted the most are going to be the least impacted, and those who are least responsible for contributing to greenhouse gas emissions and climate change are going to be the most impacted. So huge ethical issue, and makes it really, really important for us to ensure that vulnerable groups have a seat at the table and meaningful contributions to designing solutions and the decisions that are affecting them. This requires us to think not only about what our ecological ceiling is, so this is a commonly cited diagram within planetary health that thinks about kind of the safe and just space for human existence within the ecological boundaries of our planet. So the inner circle there is our social foundation, or ensuring that we're meeting the basic needs of people around the world, and that's including access to clean water, food, health and education, livelihoods, social equity, all of those things. So at the baseline there, we see that we're actually in the red, falling short on a lot of those things for a lot of people around the world. However, the outer green circle there, that's our ecological ceiling. And so that is where we are actually, that's our safe space, that we need to stay under that in order to live sustainably and not exhaust the resources on our planet and otherwise impact the planet beyond repair. So you can see also we're kind of we're overextending our budget on that side with biodiversity loss and climate change and land conversion. And so we're kind of missing the mark on both sides. And so Planetary Health is focusing on how do we get below that ecological ceiling while also bringing up the social foundation and existing kind of in that spot, in that green donut there that is both safe and promotes justice for people around the world. The final piece to the Planetary Health Framework is the idea of movement building and systems change. So centering really on solutions, not just problems, thinking about how we can take and work together across disciplinary silos, take approaches that work on multiple scales, so looking at solutions that are maybe hyper-local, maybe they're a regional, statewide, national, or even a global approach. It's going to take all of those things to really effectively address these issues. Again, keeping that inclusivity and equality as kind of a central tenet, doing good broad communication of issues, of solutions, of the need for kind of community political awareness and political will to move things forward, doing good risk identification, monitoring, kind of adaptive learning to our process of coming up with solutions, enacting change, and then reevaluating and responding to dynamic needs. All of this together, kind of forms the basis of what we need to do to focus on solutions and promote this kind of safe, just living space for us to promote the health of humans and the health of the environment and the planet, and kind of focus on that intersection between the two and find solutions that are wins across the board for us. If you are intrigued by this approach and you want to learn a little bit more, I highly recommend the Planetary Health Alliance as a resource. A lot of tools for educators, case studies, examples, networking opportunities, etc. So really great organization. I recommend it if you want more info. Hopefully this was helpful to you in kind of framing the context as we go forward through the rest of these modules, and you can kind of think about how this all fits within the Planetary Health Framework. Thanks so much. On to the next section.